Okay. You can sit there, and I'll be sitting too.
Okay.
First of all, let us give a brief description about where we work. We are right now in Fulya, Beşiktaş, very central Istanbul. At the bottom of this building, we have İstanbul Bariatrics. Our office is located there. And this building that we are in now is the hospital that we operate. And today, we are with a patient that we are preparing for the discharge. Okay, Kadisha, huh?
Yes.
A 23-year-old young lady from originally from Dominican Republic, also Moroccan background you have.
Yes.
And actually she had metabolic syndrome, although her BMI value wasn't more than 35.
Mm-hmm. It was 34.
It was 34, so you had insulin resistance, right?
I had like a beginning.
Yeah, just the beginning, yeah. Mm-hmm. So it will already probably pass now since you are operated on, because some of the comorbidities, especially the insulin resistance, is not, our expectation for that is before the weight loss, like sleep apnea, hypertension. If they are caused by obesity, they generally go away once the patient loses like 15, 20, 30 kilograms. But in the case of type 2 diabetes, since the hormonal milieu of the body changes after sleeve gastrectomy, it has a direct effect on insulin resistance, so maybe it's already gone now.
Hopefully.
Yeah. So thank you very much for accepting this interview, and in a moment I will let you talk more. But now this is your third day and you're being discharged from the hospital, so let me tell you what you should do. Okay. First of all, since Istanbul Bariatrics, we give blood thinners another week after the discharge, so you will be making your heparin injections every day, another 7 days. And we want you to be fully mobilized. You should walk every day, maybe a couple of kilometers, and this should go more and more. And after 30-40 days, we will ask you to do some other exercise, and 3-5 months later other type of exercises, and we will tell you about them. But for the time being, when you go home, you'll be taking a very small pill, which is a PPI, proton pump inhibitor, which we want you to use for a couple of months after the surgery. And the heparin injections are only for a week. And there is one tablet that you should take lifelong, which is
vitamins.
Vitamins, yeah. As you know, since there is no bypass part of this operation, it's only sleeve gastrectomy. Generally speaking, only a single vitamin all your life is all you need.
Perfect.
And starting from today, when you're going home today, we want you to drink water, at least 1.5 liters every day. And also what you should do about the dieting from now on, especially for the first month, will be explained to you by our dietitian.
Yes.
And please, for a couple of days or maybe for a week, measure your temperature at a hotel or home, wherever you are going. And if it is ever over 38 degrees Celsius, or if you have to start a new kind of abdominal pain, or if your general status worsens or anything like that, just call us.
Of course.
You can reach us 24 hours a day. We're a bunch of surgeons. You're always on call. So please do not waste your time and call us. But those things are very, very, very unlikely, because you had a very straightforward post-operative course. Your POD, upper GI X-ray was perfect. There's no obstruction, and you're drinking very nicely, and this is your discharge day. So, what do you think about the whole process? Coming here, having the operation with us, sleeve gastrectomy itself. How did that affect you? What do you suggest for other people who are having this similar problem. So, what do you say?
Personally, the process I found was a lot easier than I expected it to be.
Okay.
So the team is very welcoming and very helpful, which is something that was very important for me. It's part of the reason why I chose this team.
Yeah.
It's because it really make you feel at ease, make you feel comfortable, and you know that you can trust them. Like you mentioned, that I can call anytime. I have, I think, everyone's number in your team in my phone. And for me, the worst part, it wasn't really that bad, was the nausea.
Okay.
Just the nausea.
How long did it affect
2
you?
days.
2 days. 1 or 2
Yeah.
days. It's very common. Yeah.
Yes, it was just 2 days. The first 2 days I had a bit of nausea. So that was the only part that it's not that it hurt, it was just discomfort.
What about pain in general?
Pain, I didn't really have pain. It was
Yeah.
more discomfort. I don't want to call it pain because it wasn't painful. It was really just uncomfortable a bit, but it wasn't bad at all. I expected a lot more, actually.
And only 72 hours passed over your surgery.
Yes,
so
that's true. I don't realize
what you're
it.
talking about is the first few days. Maybe the first day was the worst. Maybe.
Yeah.
And okay, so
It
it
really
was
wasn't
better
bad.
than you expected.
Yes, a lot better.
Okay, so but you are also aware that in the case that you don't work on this, because I generally consider bariatric surgery, weight reduction surgery, like a golden key.
Yes.
That otherwise, without that key, that door is unopenable. You know.
Yeah.
So it really helps people. It really helps. It really saves lives all around the world. But you should always know that after 10 years, the mathematical risk of being morbidly obese again is not zero.
Yes, you do
It is
have
maybe
chances
10
of
to
doing
15% of the patients will require a second operation.
that. Yeah.
So the good thing, if you can, you will lose weight very nicely in a year and a half, and then you should be able to protect that. And for that purpose, you should work on your mind too a little bit. You should work with our psychologists regarding some foods that you carve, psychological eating disorders type of problem. You should work on those. And if you integrate sporting, exercising in your life more, and if you avoid from alcohol, if you stay away from alcohol, and the things that melt in the mouth, if you never take them, so high protein, 1/3 of your plate should be protein all the time, 2/3 should be vegetables. Carbs, we don't like them very much. Empty carbs, we hate them. And if you take care about all of those things, on the long run, you'll be very successful. Otherwise, you may need another surgery. Sleeve gastrectomy easily allows that. It's a very versatile procedure. It's one of the reasons that it became the gold standard now. And our weight loss rates are very high. We are doing our tubes a little bit narrow, most probably. So after 1 year, you will be expected to lose like 90% of your excess body weight.
Perfect.
Thank you very much again.
Thank you for the surgery, and thank you to all your team and the nurses at the hospital. It was a very pleasant stay.
Thank you. Thank you very much.